101. What is the most common complication associated with untreated hyperthyroidism? A. Dehydration. B. Osteoporosis. C. Anemia. D. Hypoglycemia. Answer: B. Osteoporosis. Rationale: chronic hyperthyroidism increases bone turnover, leading to osteoporosis due to calcium loss. 102. Which of the following tests is used to diagnose diabetes mellitus? A. Oral glucose tolerance test, OGTT. B. Complete blood count, CBC. C. Serum creatinine level. D. Chest X-ray. Answer: A. Oral glucose tolerance test, OGTT. Rationale: the OGTT is a diagnostic test used to assess glucose metabolism and diagnose diabetes mellitus by measuring blood glucose levels after ingestion of glucose. 103. What is a primary concern in a patient with hyperkalemia? A. Hypotension. B. Cardiac arrhythmias. C. Respiratory acidosis. D. Hypoglycemia. Answer: B. Cardiac arrhythmias. Rationale: hyperkalemia can cause life-threatening cardiac arrhythmias, particularly due to its effect on the electrical activity of the heart. 104. What is the most appropriate treatment for a patient with hypothyroidism? A. Antithyroid medications. B. Radioactive iodine. C. Levothyroxine therapy. D. Thyroidectomy. Answer: C. Levothyroxine therapy. Rationale: levothyroxine is the standard treatment for hypothyroidism as it replaces the deficient thyroid hormone. 105. Which of the following signs is most commonly associated with an adrenal crisis? A. Severe hyperglycemia. B. Hypotension and confusion. C. Seizures. D. Chest pain. Answer: B. Hypotension and confusion. Rationale: adrenal crisis presents with hypotension, confusion, and severe weakness due to insufficient cortisol production, often requiring emergency treatment. 106. What is the most common cause of hypothyroidism in the United States? A. Iodine deficiency. B. Hashimoto's thyroiditis. C. Pituitary tumor. D. Medications such as lithium. Answer: B. Hashimoto's thyroiditis. Rationale: Hashimoto's thyroiditis is an autoimmune disorder and the most common cause of hypothyroidism in the U.S., leading to chronic thyroid gland destruction. 107. Which of the following is the primary function of cortisol in the body? A. Regulate calcium balance. B. Control blood sugar levels. C. Stimulate red blood cell production. D. Regulate reproductive hormones. Answer: B. Control blood sugar levels. Rationale: cortisol helps regulate blood glucose levels by stimulating gluconeogenesis and inhibiting insulin action. 108. Which of the following is a characteristic feature of diabetic nephropathy? A. Retinopathy. B. Proteinuria. C. Tachycardia. D. Hypokalemia. Answer: B. Proteinuria. Rationale: proteinuria, the presence of excess protein in the urine, is a hallmark sign of diabetic nephropathy, often leading to kidney dysfunction and diabetes. 109. Which of the following is the most common cause of hypercalcemia in hospitalized patients? A. Parathyroid adenoma. B. Malignancy. C. Chronic kidney disease. D. Hyperthyroidism. Answer: B. Malignancy. Rationale: malignancy, particularly cancers like lung and breast cancer, is a leading cause of hypercalcemia due to tumor-induced release of parathyroid hormone-related protein. 110. Which of the following medications can be used to treat hyperaldosteronism? A. Spironolactone. B. Insulin. C. Levothyroxine. D. Metformin. Answer: A. Spironolactone. Rationale: spironolactone, an aldosterone antagonist, is used to treat hyperaldosteronism by blocking the effects of aldosterone and reducing sodium and water retention. 111. What is the most effective treatment for type 2 diabetes mellitus? A. Insulin injections. B. Oral hypoglycemic medications. C. Lifestyle modifications and diet. D. A combination of insulin and oral hypoglycemics. Answer: C. Lifestyle modifications and diet. Rationale: Lifestyle modifications such as dietary changes and increased physical activity are the most effective treatments for type 2 diabetes, especially early in the disease course. 112. Which of the following symptoms is most indicative of hypothyroidism? A. Rapid heart rate. B. Weight loss. C. Cold intolerance. D. Sweating. Answer: C. Cold intolerance. Rationale: cold intolerance is a common symptom of hypothyroidism, as decreased thyroid hormone levels reduce the body's ability to regulate temperature. 113. What condition is characterized by excessive secretion of growth hormone in adults? A. Acromegaly. B. Gigantism. C. Hyperthyroidism. D. Cushing's syndrome. Answer: A. Acromegaly. Rationale: acromegaly is caused by excessive growth hormone secretion in adults, leading to abnormal growth of tissues and bones, particularly in the hands, feet, and face. 114. What is the most common cause of hypoglycemia in diabetic patients? A. Insulin overdose. B. Dehydration. C. Hypercalcemia. D. Kidney disease. Answer: A. Insulin overdose. Rationale: insulin overdose is the most common cause of hypoglycemia in diabetic patients, as it causes excessive lowering of blood glucose levels. 115. What test is used to confirm the diagnosis of pheochromocytoma? A. Urinary catecholamines test. B. Thyroid function tests. C. CT scan of the abdomen. D. Serum glucose level. Answer: A. Urinary catecholamines test. Rationale: the urinary catecholamines test is used to diagnose pheochromocytoma by measuring elevated levels of catecholamines and their metabolites. 116. What is the initial treatment for a patient experiencing an adrenal crisis? A. For hydrocortisone. B. Intravenous glucose. C. Oral prednisone. D. Diuretics. Answer: A. For hydrocortisone. Rationale: for hydrocortisone is the first-line treatment for adrenal crisis, as it provides immediate cortisol replacement. 117. Which of the following is a common side effect of corticosteroid use in the treatment of adrenal insufficiency? A. Weight loss. B. Osteoporosis. C. Hypercalcemia. D. Hyperpigmentation. Answer: B. Osteoporosis. Rationale: long-term corticosteroid use can lead to osteoporosis due to the inhibition of bone formation and calcium absorption. 118. In patients with hyperthyroidism, which of the following is an expected laboratory finding? A. Elevated TSH and low T3. B. Elevated T3 and T4. C. Low T3 and low T4. D. Low TSH and elevated T3. Answer: B. Elevated T3 and T4. Rationale: in hyperthyroidism, the thyroid produces excessive amounts of T3 and T4, causing an imbalance in thyroid function tests. 119. What is a common complication of untreated diabetic retinopathy? A. Glaucoma. B. Cataracts. C. Blindness. D. Macular degeneration. Answer: C. Blindness. Rationale: diabetic retinopathy can cause significant damage to the blood vessels in the retina, leading to vision loss or blindness if left untreated. 120. What is the primary diagnostic tool for confirming the presence of diabetic ketoacidosis, DKA? A. Blood glucose level. B. Urine ketones test. C. Arterial blood gas, ABG. D. Serum sodium level. Answer: C. Arterial blood gas, ABG. Rationale: an ABG test is crucial in diagnosing DKA as it shows metabolic acidosis with low pH and low bicarbonate levels, which are characteristic of the condition. 121. Which of the following is a common clinical sign of Cushing's syndrome? A. Weight gain and buffalo hump. B. Weight loss and tremors. C. Hypotension and fatigue. D. Excessive hair growth and acne. Answer: A. Weight gain and buffalo hump. Rationale: Cushing's syndrome often causes weight gain, especially around the abdomen and face, and a buffalo hump, which is fat accumulation on the upper back. 122. What is the first-line treatment for hyperparathyroidism due to parathyroid adenoma? A. Calcitonin. B. Parathyroidectomy. C. Bisphosphonates. D. Hormone replacement therapy. Answer: B. Parathyroidectomy. Rationale: parathyroidectomy is the treatment of choice for primary hyperparathyroidism caused by a parathyroid adenoma, as it removes the source of excess parathyroid hormone. 123. Which of the following tests is used to assess thyroid function? A. TSH and free T4 levels. B. Urine sodium concentration. C. Blood urea nitrogen (BUN) test. D. Serum calcium levels. Answer: A. TSH and free T4 levels. Rationale: the TSH and free T4 levels are commonly used to assess thyroid function, with abnormal levels indicating hypo or hyperthyroidism. 124. In Addison's disease, which hormone is deficient? A. Cortisol. B. Insulin. C. Thyroid hormone. D. Parathyroid hormone. Answer: A. Cortisol. Rationale: Addison's disease is characterized by a deficiency in cortisol production due to adrenal gland insufficiency. 125. What is a characteristic laboratory finding in diabetic ketoacidosis, DKA? A. High blood glucose and positive urine ketones. B. Low blood glucose and low potassium levels. C. Elevated TSH and free T4 levels. D. Low calcium and elevated vitamin D levels. Answer: A. High blood glucose and positive urine ketones. Rationale: DKA is marked by elevated blood glucose levels and the presence of ketones in the urine, indicating a state of severe insulin deficiency. 126. Which of the following is a common symptom of hyperthyroidism? A. Weight gain and lethargy. B. Weight loss, heat intolerance, and tremors. C. Cold intolerance and depression. D. Lethargy and constipation. Answer: B. Weight loss, heat intolerance, and tremors. Rationale: hyperthyroidism commonly presents with weight loss, heat intolerance, and tremors due to excessive thyroid hormone production. 127. Which of the following is a key feature of diabetic neuropathy? A. Muscle weakness and joint pain. B. Numbness and tingling in the feet. C. Excessive sweating and hot flashes. D. Blurred vision and weight loss. Answer: B. Numbness and tingling in the feet. Rationale: diabetic neuropathy often presents as numbness, tingling, or a pins and needles sensation, particularly in the lower extremities. 128. What is the first-line treatment for hypothyroidism? A. Propylthiouracil. B. Levothyroxine. C. Methimazole. D. Hydrocortisone. Answer: B. Levothyroxine. Rationale: levothyroxine is the standard treatment for hypothyroidism as it replaces the deficient thyroid hormone. 129. What is the main goal of therapy for patients with diabetic retinopathy? A. Prevent further progression of the disease. B. Treat underlying hypertension. C. Promote vasodilation. D. Correct refractive errors. Answer: A. Prevent further progression of the disease. Rationale: the main goal of therapy in diabetic retinopathy is to prevent the progression of retinal damage, typically by controlling blood glucose and blood pressure. 130. Which of the following is a typical sign of hypoglycemia? A. Hot and dry skin. B. Increased urination. C. Shaking, sweating, and confusion. D. Slow heart rate and low blood pressure. Answer: C. Shaking, sweating, and confusion. Rationale: hypoglycemia is typically characterized by symptoms such as shaking, sweating, confusion, and irritability due to low blood glucose levels. 131. Which of the following conditions is associated with the development of diabetic ketoacidosis, DKA? A. Hyperglycemia with insulin deficiency. B. Hypoglycemia with insulin overdose. C. High blood pressure and high sodium levels. D. Low blood sugar and ketosis. Answer: A. Hyperglycemia with insulin deficiency. Rationale: DKA occurs when there is insulin deficiency, leading to hyperglycemia and ketosis as the body breaks down fats for energy. 132. What is the hallmark of Graves' disease? A. Hyperthyroidism with a goiter. B. Hyperparathyroidism with hypercalcemia. C. Hypothyroidism with a goiter. D. Primary adrenal insufficiency. Answer: A. Hyperthyroidism with a goiter. Rationale: Graves' disease is an autoimmune disorder that causes hyperthyroidism and is commonly associated with a goiter, which is an enlarged thyroid gland. 133. What is the primary cause of type 2 diabetes mellitus? A. Autoimmune destruction of pancreatic beta cells. B. Insulin resistance and decreased insulin secretion. C. Insulin overdose. D. Excessive thyroid hormone production. Answer: B. Insulin resistance and decreased insulin secretion. Rationale: Type 2 diabetes is primarily caused by insulin resistance and an eventual decrease in insulin secretion, leading to impaired glucose metabolism. 134. What is the most common long-term complication of uncontrolled type 1 diabetes mellitus? A. Retinopathy. B. Osteoporosis. C. Anemia. D. Chronic kidney disease. Answer: A. Retinopathy. Rationale: Diabetic retinopathy is a common long-term complication of uncontrolled type 1 diabetes, leading to damage of the blood vessels in the retina and potentially resulting in blindness. 135. What medication is typically used to treat hypothyroidism? A. Methimazole. B. Propylthiouracil. C. Levothyroxine. D. Fludrocortisone. Answer: C. Levothyroxine. Rationale: Levothyroxine is the synthetic thyroid hormone used to replace the deficient thyroid hormone in hypothyroidism. 136. What is a major risk factor for developing Cushing's syndrome? A. Chronic use of corticosteroids. B. Excessive use of thyroid hormone. C. High-protein diet. D. Chronic alcohol use. Answer: A. Chronic use of corticosteroids. Rationale: Chronic corticosteroid use can lead to Cushing's syndrome due to prolonged exposure to high levels of corticosteroids, leading to symptoms like weight gain and skin thinning. 137. Which of the following is a common complication of untreated hypothyroidism? A. Myxedema coma. B. Diabetes insipidus. C. Diabetic retinopathy. D. Metabolic alkalosis. Answer: A. Myxedema coma. Rationale: Myxedema coma is a rare but life-threatening complication of severe hypothyroidism marked by hypothermia, bradycardia, and altered mental status. 138. Which of the following is a symptom of hyperparathyroidism? A. Hypertension. B. Bone pain and fractures. C. Diarrhea. D. Excessive thirst. Answer: B. Bone pain and fractures. Rationale: Hyperparathyroidism results in high calcium levels, which can lead to bone pain and fractures due to increased bone resorption. 139. What is the main cause of secondary hyperparathyroidism? A. Chronic kidney disease. B. Parathyroid adenoma. C. Vitamin D deficiency. D. Primary hyperthyroidism. Answer: A. Chronic kidney disease. Rationale: Chronic kidney disease leads to decreased calcium levels, which stimulates excessive parathyroid hormone release, causing secondary hyperparathyroidism. 140. Which of the following is a risk factor for developing hypothyroidism? A. Autoimmune disorders. B. High levels of iodine. C. Low blood pressure. D. Vitamin C deficiency. Answer: A. Autoimmune disorders. Rationale: Autoimmune diseases such as Hashimoto's thyroiditis are the most common cause of hypothyroidism, where the immune system attacks the thyroid gland. 141. What is the primary cause of diabetic ketoacidosis, DKA? A. High blood glucose and low insulin levels. B. Excessive insulin administration. C. Excessive fluid intake. D. Low blood sugar levels. Answer: A. High blood glucose and low insulin levels. Rationale: DKA is caused by high blood glucose and low insulin, leading to fat breakdown and ketone production, resulting in acidosis. 142. What is the hallmark sign of Cushing syndrome? A. Moon face. B. Hypotension. C. Weight loss. D. Hypoglycemia. Answer: A. Moon face. Rationale: moon face, a round, puffy face, is a hallmark sign of Cushing syndrome due to excessive cortisol levels. 143. What is the primary treatment for hyperaldosteronism? A. Adrenalectomy. B. Oral corticosteroids. C. Spironolactone. D. Antidiuretic hormone therapy. Answer: C. Spironolactone. Rationale: spironolactone, an aldosterone antagonist, is commonly used to treat hyperaldosteronism by blocking the effects of excess aldosterone. 144. Which of the following is a major risk factor for developing type 2 diabetes? A. Age over 45. B. Frequent exercise. C. Low body weight. D. Low sodium diet. Answer: A. Age over 45. Rationale: age over 45 is a significant risk factor for developing type 2 diabetes, as insulin resistance increases with age, especially in individuals with other risk factors like obesity. 145. Which of the following is a typical feature of Graves' disease? A. Exophthalmos. B. Goiter with pain. C. Weight gain and constipation. D. Cold intolerance and depression. Answer: A. Exophthalmos. Rationale: exophthalmos, or bulging eyes, is a typical sign of Graves' disease due to the autoimmune nature of the condition. 146. What is the main treatment for pheochromocytoma? A. Surgery to remove the adrenal tumor. B. Chemotherapy. C. Insulin therapy. D. Dialysis. Answer: A. Surgery to remove the adrenal tumor. Rationale: pheochromocytoma is treated by surgical removal of the adrenal tumor, which causes excess catecholamine production. 147. What hormone is most commonly associated with Addison's disease? A. Cortisol. B. Thyroxine. C. Insulin. D. Growth hormone. Answer: A. Cortisol. Rationale: Addison's disease is characterized by cortisol deficiency due to damage to the adrenal glands. 148. What is the main cause of hyperparathyroidism? A. Parathyroid adenoma. B. Vitamin D deficiency. C. Hypothyroidism. D. Adrenal insufficiency. Answer: A. Parathyroid adenoma. Rationale: parathyroid adenoma is the most common cause of primary hyperparathyroidism, leading to excess parathyroid hormone secretion. 149. What is the most effective long-term treatment for obesity-related hypoventilation syndrome? A. Continuous positive airway pressure, CPAP. B. Weight loss surgery. C. Antidepressants. D. Insulin therapy. Answer: B. Weight loss surgery. Rationale: weight loss surgery is the most effective long-term treatment for obesity-related hypoventilation syndrome, as it addresses the root cause of the condition. 150. Which of the following is a typical symptom of Addison's disease? A. Hyperpigmentation of the skin. B. Weight gain. C. Excessive thirst. D. Increased heart rate. Answer: A. Hyperpigmentation of the skin. Rationale: hyperpigmentation is a hallmark symptom of Addison's disease due to elevated ACTH levels stimulating melanocytes.